Podcast. Igniting both the art and the science of functional medicine. Here's your host, Dr. Brad Watts.
Hey, what's going on, everybody? This is Dr. Brad Watts with the Nutrition Hero Podcast. Thank you for tuning in to this episode. And today I have a guest for you out of Virginia. This is a naturopath, a phenomenal practitioner. Her name is Dr. Huber, and we're going to talk quite a bit about autism today. Little kids, her story, her family's story, and a way forward. Her son now being in a spot where he's considered recovered. And that's not something that you hear a lot about when it comes to autism. So that's what piqued my interest. That's why I get excited to talk to this doctor. And so anyway, phenomenal. If you are listening on iTunes, hit that 5-star button. All right, we appreciate your reviews. It helps position us in the marketplace. And if you are on YouTube, hit subscribe, hit the little bell, the dinger, so that you get notified anytime we have a new episode out, and we should be set there. So if you would like to hear about a specific topic on the Nutrition Hero Podcast, please email me, b@drbradwatts.com, b@drbradwatts.com, and let's continue the conversation. So without any further ado, please welcome Dr. Huber to the Nutrition Hero Podcast. All right, Doctor, welcome to the Nutrition Hero Podcast. Thank you for being here. I appreciate it.
Well, thank you for having me. I'm excited.
Absolutely.
Excited to share.
I'm excited to talk with you, by the way. I've been reading up on some of the things you're doing and some of the things you've done. But what I want to do is first, I want to start out talking about why natural health care. Why'd you get involved in this crazy space to begin with?
Yeah, well, I mean, it's a tale I've heard quite a few times now. A lot of us are led into this realm because of our own health experience, maybe not finding the solutions we were looking for in Western medicine. And yeah, I grew up using mainstream Western medicine my whole life. My mother's an RN, and I have a lot of respect for it. But I ended up developing a lot of chronic health conditions. My older son was diagnosed with autism. And so through these experiences, we realized we had to dig deep. We had to look at lifestyle. We had to look at diet. We had to look at detoxification and all kinds of things that were not common language at the doctor's office. So yeah, that's what got us into it. And my son, he's almost 12 now. But he was diagnosed when he was about 3 years old with classic autism. So that really is where we had just this thing thrown into our laps. We didn't know what to do with it. And that's when we really started digging in and exploring through natural health.
So what has that journey been like with autism? But not only that, with your son in the autism situation, what's that been like?
Transformational. For the soul, I would say, absolutely. Because we're at a point now where he's what we consider recovered. So we're all in a place where it feels really, really good, and we can see who he is at his core. Like, he's a beautiful, beautiful person. When autism was at its worst, it was hard to see that because it was day in and day out of a lot of meltdowns and aggression and loss of speech and eye contact and social behaviors. We kind of lost him there for a little bit, but yeah, now it's created this just phenomenal change within my own life. We all started eating better because we found for him, diet was one of the biggest things for regaining speech for him. He had started losing words. He had some words around 18 months, and then by the time he was diagnosed, he'd lost all of those. And within a few weeks of implementing a gluten-free, dairy-free diet, he started to try and speak again. And so we really didn't expect to see something so phenomenal within a short period of time just based on food, because the psychologists who made the diagnosis, they told us that wasn't correlated at all, that it didn't matter what he was eating, that he needed to go into therapy. And even so, that we couldn't expect a lot to see with him, that he would never be in a mainstream school or have friends or go to college or have a job. And they actually said he's never going to fall in love. I mean, I can't even, and I'm not the the only person that's heard this as a parent
Mm.
when their child's diagnosed. I've heard other parents say it too. So that's kind of a shocking thing for anybody, as a practitioner, anyone to be able to say.
Right.
But he embodies love now. Like, he's a beautiful, empathetic person. He always is very concerned about other people, what's going on, family members, friends, school, all that. He's very engaged with how other people are feeling, and he wants to be there for them. Very hands-on, loving child. So, and he's had, like I said, with the diet, I mean, that got the ball rolling. We started doing a lot of nutritional therapy with vitamin supplementation, herbs, anti-inflammatories. If you're familiar with autism, there's a lot of gut healing that needs to take place. So we kind of chiseled away for years, and just the more natural we kept things, got away from, we were doing some prescription antibiotics and antifungals early on, and that's tended to just kind of throw gasoline on the fire and made things worse for him for a period of time. So once I got more into the herbal medicine on that side, he really responds great to herbs. He still takes some on occasion. So
cool.
That was huge for him.
So when you talk about when he's 18 months old and he loses some of the words that he had been learning, what does that look like from a physiology standpoint? What is going on with those food sensitivities or those food issues that's suppressing? Is it like suppressing his urge to communicate, or is it suppressing part of his brain that's triggering it? Like, what does that look like?
Absolutely affecting the brain at the same time. And I didn't realize what was going on during that time period. I didn't have any experience with babies or young children and developmental milestones they need to be making. I'd worked as a nanny, but those were with older children when I was a teenager. Yeah. So for him, a lot of what was going on, I didn't realize it wasn't normal. And he had, with his gut, he would, he got so that he was holding his stool, and I didn't know that was something that could happen. He would have, only one real bowel movement, maybe a week. And even so, I mean, every day he was having a little bit of poop in his diaper, but, and I kind of thought, oh, okay, so he's pooping, that's all right. But I didn't realize how much was like backing up into the colon and just was remaining in there, of course, being reabsorbed back through the bowel tissue into the bloodstream. So toxins were just recirculating. And absolutely, there's a tie with that gut-brain connection that with him, he was full, he was toxic, and he wasn't able to take out the trash like he needed to. He was scared of pooping, so that was part of it too. Like there was a fear there, made it hard to potty train him. But when we did take out the gluten and the dairy, we did give him some fiber supplements and things to kind of move the stool through. We did actually start getting real poops on a regular basis. Yeah. And it was scary for him at first. He couldn't talk to us at that point. And he didn't really know what was going on. And he had a lot of trouble understanding what we were asking of him. But once he started able to move the stool out more effectively on a daily basis, which to me, just when that started happening, it's like, I didn't even know this was possible, that he had this much in him. That's when the speech came. Okay. When it came, it was in the form of echolalia for a long time. So it was scripting. He was repeating back to us things we would say. He was repeating lines from his books. He could memorize stories that I would read to him. He memorized all the scripts, all the phrases from Thomas the Train. So he loved Thomas. And he would use these phrases to communicate to us. So I didn't realize it at first, but then he had meaning. He assigned meaning to all these things he was picking up from his shows and his books, and he was reciting that back to me to tell me how he was feeling or what he wanted and that kind of thing. So it was like that for a while. And there is also this unspoken communication between us and our children, absolutely. With autism, it's an intuitive, unspoken communication where it's almost like we know their needs without them even needing to tell us. So we relied on that for a long time. But the speech did come in. He was in ABA therapy and speech therapy for a few years that helped with that. Being around his peers, his neurotypical peers, was very helpful, having kids coming in and engaging with him. He has a little brother, about 2 years younger, who's helped a lot. And yeah, it just snowballed from there. You know, the more we address things for him, like not just removing gluten and dairy, but bringing in foods in their natural form, like raw fruits and vegetables, brightly colored foods, getting that plant-based, you know, the fiber, all of that in the diet. He had previously been very dependent on things like chicken nuggets and French fries, all the beige, like yucky fried things, you know, pizza. He was really hooked on that stuff. And it was just creating this loop within him where he was very addicted to those foods. So once we broke that cycle, he just continued to flourish, and he's a very healthy boy now.
So when you say the word recovered, what does that look like as a 12-year-old?
Well, there is something we use in autism called the ATAC. It's the Autism Treatment Evaluation Checklist. And I mean, that's one way to track how a child is progressing and gaining throughout the journey, the autism journey as we call it. And it's a series of questions that pertain to like cognition or social behavior, things like that. It's free. Parents or caregivers, therapists, whatever, they can go online and fill out the list and you get a score. So the higher the score, the more profoundly affected they are by autism. So if they're up around like 100, that's pretty serious. But then as you implement things, whether they be things like therapy, ABA or speech or whatever, or, you know, nutrition, or if you do a detox protocol or anything you bring in, you get your baseline ATAC and then you just reevaluate during that process to see as you get the number down. Where he would be now, I would say he's not on it at all, barely. Maybe like a 2 or a 3. I probably have a higher ATAC than he does at this point. He is, so I mean, to take him into a doctor and try and get an autism diagnosis, they'd be like, I don't know what you're talking about. There's nothing here. He's fully integrated into a mainstream classroom. He's, you know, making straight A's. He plays sports, team sports, which can be very difficult for some children on the spectrum. That was a struggle he had for a while, but he's, and like I said, he's very engaged and like tuned in with people and what's going on with them, which is light years from where he was initially. That's what recovery looks like. But children with autism tend to be very sensitive. They are very sensitive to the environment, you know, things like lights and sound and environmental, like even toxins, stuff like that. But then also the people around them, they're very sensitive to that. That's still there, because that's who he is. He's an empath. So he's naturally, you know, he's designed to feel other people, but he's stands up more strongly in it, as one way to put it now.
Wow. So with this experience that you guys have had as a family, you've leveraged that into your career here, helping other families, helping other people. What does that look like right now for your practice? What is your focus on, and what gets you excited in this space?
I love it. I work with many families. I mean, it used to be predominantly children on the spectrum. I'd probably say like 80% for a long time. And my focus is on things like pandas. If you're familiar with that, that we have happening. And that was something that was going on with my son, George, that I didn't realize for a while. You tend to just say, oh, it's just autism, and not recognize that there's underlying infections that are at play, creating a lot of the behaviors. So I look at that now. I, you know, work with diet and detoxification. Detoxification and reducing inflammation are some of the major things that I do for autism now. And I love it very much. I see the children, I see their parents, I see their siblings, I see their grandparents, you know, because we all tend to carry like similar things. It manifests a little differently in a mom from how it does in a child, but she's usually, you know, dealing with her own stuff too, just like her child. And it's been wonderful. Probably in the past year, I've brought in more people with like autoimmune
Okay.
conditions and things like that. So it's more like 50-50, not as
Sure.
much autism as I used to do, but I still, see people every week
Cool.
all over. I do things like Skype and Zoom
And blog? Tell us about that blog
the
situation.
blog just started that, it's not like I needed another thing.
Right.
We tend to do this. We're like, oh, let me take this on too.
Right.
The blog is to just provide information for anybody who needs it, not just folks I work with.
Yeah.
Homeopathy is something that I use a lot, and a lot of people still don't know what that is.
Hmm.
I've seen confusion around it. People will misunderstand it for like home remedies or something like that, and it's very different. It's its own very unique form of medicine. And so I decided to do a blog post about that and the history of it and what it is. It's all frequency based, which is fascinating to me.
Yeah.
We're not using a chemical component or an herb. So
That's
all for the
awesome. With the frequency situation, how has that, so somebody like your son, let's say,
mm-hmm.
how does that work its way into your programming with a child that's going through something like autism?
Well, homeopathy has actually been phenomenal for our children on the spectrum because
Mm-hmm.
of their sensitivity. Many of them can't do herbs. I've had kids before where we're like, oh, let's, get them on something for the liver and the gut and the endocrine. I have all these great herbs at my disposal, but it's, maybe they have a reaction and they can barely even handle one drop of a formula. It's not unusual to see that. And there's various reasons why, but homeopathy is nice because we're working with frequency. I don't want to say that it's 100% safe. It's certainly more gentle, but there are situations with homeopathy where you really want to be working with someone who understands it, because it's not just working on the physical body. To get into like the energetic
Sure.
layers in the auric field, like it's digging really into that. It's getting into trauma. It's shifting a lot of energies around, emotions. And if you take someone who's already very sensitive and you do an incorrect potency, you can aggravate them even worse than you could if you did too many herbs or that kind of thing. But overall, it tends to be very synergistic with our kids. I tend to use it in the form of detoxification, probably
Yeah,
more than
that's what I was going
anything
to ask
else.
about. Okay.
Yeah. And that's a daily dosing that would be done with it. They're fairly low potency. They take it a couple times a day at the most. And it helps drain the organs and the glands and get the tissue working as it needs to.
Very cool.
Yep.
With kids, what's the youngest that you've worked with on the autism spectrum?
Oh, say I was under 2 years old. Not quite, maybe just 18 months.
Okay.
It's because they're being diagnosed far earlier than it seemed like when it was like for my son. I mean, he was 2 weeks shy of his third birthday. And no, but I've seen one child that's not even 2 years old before that was showing.
Really?
So, yeah. But I've worked with children as young as infants for other things too. So
What percentage of the population is going through something like that right now? Do you know? Like overall, do you see this in
numbers.
adults? Yeah. Well, it doesn't have to be numbers necessarily, but do you see this in adults? Do you see this in running in families, or are these isolated incidents inside of a family group?
You mean the autism?
Yeah.
Yeah. I mean, there's a couple different numbers. Like the CDC will put numbers every now and then. They'll put out numbers, but they're usually based on a couple years ago, so it's
Okay.
never fully current. There are a few other organizations that they try to stay more on top of it. I think it's at 1 in 36 children now are on the autism spectrum. That number continues to grow. And families, it's not unusual to see similar, say, genetic mutations and weaknesses in a family line.
Gotcha.
At the same time, like you can have 5 kids and only one of them be on the spectrum and everybody else is neurotypical. It's hard to say. I mean, there's certainly a lot of parents I've worked with where they'll say it themselves. They're like, I'm an Aspie. I fully understand where my kid's coming from because I'm like this too. It's not unusual for me to hear that. But Yeah, and there's a lot of like the underlying infections that I mentioned previously.
Hmm.
A lot of those viruses, like mom has it, siblings have it, the child on the spectrum has it. It's just aggravating them more, manifesting differently through the behaviors. Um, and so, yeah, things like Lyme disease and all of those, I see them in a lot of families.
Gotcha.
Hmm.
One of the things that you are skilled at is working with patients and fasting.
Hmm.
And what is what styles of fasting do you usually employ, and what around that, what kind of conversation do you have with the patient where you're like, so you're not going to eat, right? Like what does that look like?
I really only recommend that when I can tell that they're vibing with it and that's something
Okay.
that's going to work into their lifestyle. Fasting should never be something where, and let me first say there's many different ways to fast.
Hmm.
The type I work with that I'll talk about, it's definitely one that you don't just go from a standard American diet and throw yourself into a fast. I'm a big fan of dry fasting, intermittent dry fasting. I use it myself all the time. But there's other forms. There's water fasting, there's juice
Sure.
fasting, there's mono fruit fasting, which I do a lot of as well, which is where you just eat the same type of fruit for a
Yeah.
period of time. Examples would be like red grapes or watermelon or citruses, that kind of thing. Um, but it's definitely something you want to just transition into very slowly. I don't do it with children. However, I've met people who do, and I fully support that. But dry fasting, I feel like that's something that you should be naturally drawn to it. Um, I actually, there's one 13-year-old girl, I remember seeing her story online that was really incredible that she was a dry faster. But yeah, it's something that psychologically you really need to be present and aware of what you're doing there. Um, but yeah, I'll start people out with it. Typically, they're folks who are into the more alkaline way of eating. Um, they're already eating a lot of raw foods, some cooked foods, and we'll talk about things like enemas as well, because I feel like when you get into the fasting, you need to be, somewhat aware of how enemas can benefit the process too. Yeah.
Cool. With autophagy, which is ultimately what people are aiming for usually,
Mm-hmm.
with fasting, what are some of the things that you've seen from a detoxification perspective or from a cellular healing perspective? What does that look like as far as progression? Somebody has diabetes, or maybe somebody has an autoimmune condition,
Mm-hmm.
and you give them an opportunity to go through a dry fast. What do they expect? What do they see as they move forward?
It's interesting how everybody expects something different. They all seem to have something different in mind, or they'll ask me what they should see.
Sure.
Um, I think that kidney filtration is something that's really important. I know a lot of folks that will collect their urine in a mason jar and store it in the fridge overnight, just to make sure they're seeing a lot of that old cellular debris coming out through the lymph. What it'll do when you put it in the fridge is it'll like rise up to the top. It's lipid based, so you get like
Mm.
a fatty layer of that old cells that are all sitting up at the top. And you want to see that as you're fasting, because that shows that your kidneys are filtering in a healthy way. Fasting's interesting though, like you experience, because it's a healing process, you can be experiencing high levels of energy and feeling really fantastic, and you're just like, how am I even running off of anything right now? But then also you can have the other side of things with headaches or shortness of breath, fatigue,
Hmm.
things like that, because we need to be aware that we're just it's a matter of like removing blockages,
Yeah.
I guess is what we're doing. We're allowing the body to just really get to work and not have to put its energy towards anything else except cleansing. And so you're mobilizing at that point, you're mobilizing toxins. Um, Depending on what else you may be doing, if you're taking herbs or eating other foods that are cleansing the tissues, then I tell people it's like taking a sponge, a dirty, dirty sponge, and squeezing it in a clear mountain stream. That
Mm.
stuff still has to get out,
Right.
and you have to respect the process. So sometimes it doesn't feel great, sometimes it feels fantastic, and once you get on the other end of it,
Right.
um, and everybody's different, is it something you've got to do once a
Right.
week, or is it like a 24-hour fast that you do,
Right.
or a daily
Right.
18-hour? I mean,
Right.
we're all kind of different. I think when we get to this level of healing, there's that mind-body awareness that we need to have where we're really listening intuitively to, how much more do I need to go in this direction?
Yeah.
Should I back off a little bit? You really get in tune with how everything's working.
Absolutely.
Yeah.
All right. So one of the things that I would wonder about then is a patient, like how long are you going to plan out a dry fast for, really is the question. Like, what does it look like? I know it's going to be different for each patient, but
Mm-hmm.
are you talking hours or are you talking like, hey, until next
Hours.
Thursday, here's what we're doing?
No, well, ideally you want to already have them, like I said, transitioning into a good diet, not going to McDonald's every day and that kind of
Sure.
thing. But
That
because
would be like
that
really.
can kill a person if you
That's
eat
what I
like
was gonna
that
say.
and you go into fasting. That happens. So it's and
That would be like abusive on the
yeah,
physiology
no,
right
you can't do that.
there.
So I mean, for any practitioners who are really looking to incorporate fasting into their protocols, study all the different forms. Dry fasting is not going to be the thing that you need to go to for everybody. It's my personal favorite just because of my experience. But I probably have more people with me now who are doing the mono fruit fasting and the juice fasting. Just at this point in time, I have more people doing that. But hours is a thing. Like dry fast, I definitely keep it with hours. I'll say, start after dinner, start at night, because then you're getting a good chunk of that fast done while you're asleep.
Yeah.
Go 16, 18 hours. So you're going into that next day, and just start that way. If you want to do it once a week to begin, but every single day, I know a lot of people do that, but they don't always start like that. They just kind of dip in, and like Sunday night is when I do my dry fast into Monday. And then you want to break it with either like a light fruit meal, some tea or juice. You want to sip on it. You don't want to go get a big meal or guzzle a big old drink right at the end. You need to be careful when you break it as well.
Yeah.
And that's when I get into the education about the enemas too, because it's usually a good idea to do an enema before a fast and then also at the end.
Gotcha.
Yeah.
With your monofruit fasting, what are some of the benefits of doing a monofruit fast versus a dry fast?
The fruits they're astringents. So they will pull stagnant, lymph out of the tissue where it's just creating blockage in that flow. And so you're looking at like the melons that I mentioned, citruses and grapes. Red grapes are a stronger astringent than green or white, I mean.
Okay.
And when you're just eating these, they're going in as medicine. Like they're feeding you too at the same time. So you can do a fast longer when you're doing it this way. You can do this for a couple of days, weeks even. And you're just consuming these foods that have very astringent cleansing properties on the tissue. So, and also things like watermelon that helps open up the kidney function. Watermelon though is like, it's so strong if that's all you're eating.
Yeah.
I've had people say, I don't like watermelon. It doesn't make me feel good. I'm like, dude, that's because it's cleaning for you. Like
Right.
I had one friend who was mono fruit fasting on the watermelon, and he got all this congestion up. His nose just started pouring all this mucus out because it was pulling all this stuff out of the sinuses, and he had all this stuff in the throat, and he was seeing mucus in his stool. I mean, it was just pulling all that stuff out. So they're powerhouses. The wet ones, the high water content fruits are the ones that do that.
Volume wise and timing wise, what are you typically recommending for your patients?
For the fruit fasting?
Yeah.
I tell them, don't make it like 3 meals a day kind of deal. You eat when you're hungry,
Okay.
and you eat until you're full. And you'd be surprised how satiating grapes are. Like they're quite filling. And it really depends on the person because, of 2 to 3 days of a fruit fast or a week, it's going to depend on how much they're moving. Like if they're getting really uncomfortable, starting to feel like some joint aches. And I want to say during all of this process, I usually have them on herbal supports for the kidneys, the bowels, the liver, the lymphatic, the endocrine system, at least those. But sometimes we'll add in some other formulas because the herbs are designed to make that whole process easier and not stress out the glands. Because when you do push too hard, you can actually deplete them. But yeah, it depends on them and how they're feeling. Sometimes being on a binder, if you're
Yeah.
practitioner, you're familiar with working, yeah, so
Mhm.
that can help a lot with any discomfort as stuff's moving out. But yeah, I mean, I know people who've eaten fruit. I ate fruit, only fruit for 6 months. That was a huge thing for me in my healing. So when it's in season and it's ripe and it's calling to you,
Sure.
yeah, you can. I mean, it was a huge part of my healing. Um, it's individually based.
That's cool.
Yeah.
That's cool. You don't hear much about monofruit fast right now in natural healthcare, so that's why I had to
I
ask. That's
know,
awesome.
it's I studied under Robert Morse, Dr. Robert Morse. He's a naturopath in Florida who traditional naturopath, and
Sure.
he taught me the importance of recognizing the chemistry of what we're eating and putting in. And when we really are trying to cleanse and regenerate tissue, we need to stay more alkaline dominant, but with that water content too, which only the fruits carry that.
Yeah.
You think about like a pile of lettuce,
Right.
spinach, or it's not going to do that. And not even things like mangoes or dates or avocados. I mean, I love to eat those things, but they're not especially cleansing either.
Yeah.
He taught me a lot about how to cleanse tissue. I mean, I was on Synthroid for 8 years and for Hashimoto's, and I got off of it by cleansing and regenerating through the
That's
fruit.
awesome.
Yeah.
So when you talk about getting off of the Synthroid, do you regenerate thyroid function with that?
Yep.
Okay,
Yeah.
that's awesome.
It was fascinating because my endocrinologist had said to me, look, you can't get off of this. You're going to have a heart attack. And I was like, okay, I hear you, but
Right.
I'm studying to be a naturopath. I'm stubborn. I'm very stubborn. Like, I do not want to be dependent on a pharmaceutical. And I didn't think it was possible until I really started studying. And I said, okay, I have a thyroid still. It's
Hmm.
still here. Can I actually, you know, get it back to where it's functioning as it should?
Yeah.
And it took a lot of trust in myself because there are very few doctors out there. I mean, like people like within my realm who are going to be like, okay, yeah, let's get you off of this prescription and do, because it's a scary zone to get in.
Hmm.
Um, for me, when I did it, I stopped the Synthroid. I did a glandular for a period of time, and then I worked with some herbs. And I also had to address the Epstein-Barr because that was a factor in my
Sure.
thyroid function. But my body temperature went back to normal after I stopped. Like my body temperature kept staying like right at 97 degrees or a little bit low.
Hmm.
And my endocrinologist said, oh, that's normal. That's just going to be like that. It's like, well, isn't that an indication that maybe my thyroid still isn't where it needs to be? And he's like, no, your numbers are good. You're fine. Um,
Right.
but when I actually healed it, now I feel warm in a cool room where it's before I had to have like layers on me and that kind of thing. Um,
Cool.
yeah, it's interesting.
Very cool. So, how do we find you? Where are you online? What's your home website,
I
etc.?
I am. It's a weird name.
Sure.
It's named after an ancient story that I tie in with my son's healing. So that's why we named it that. But Ascalon it's ascalonnaturopathic.com, and
All right.
that's ASCALON
Gotcha.
naturopathic.com. I'm on Facebook.
Hmm.
I'm on Twitter. I'm on Instagram and Pinterest. I have a lot of foods on Pinterest for people who are interested in, cooked and raw and all kinds of different recipes and things on there. And of course, the website, like I talked about with the blog and that kind of thing.
Oh,
So
the blog is on the website that you just
the
mentioned?
blog is on my website.
Okay.
I have a little bit happening on YouTube. That's been kind of slow to start just because I've been busy, but I
Sure.
hope to have more on there too.
All right.
And
I
then you
got
can
to tell you, I appreciate your time today. Thank you for sharing your
You're welcome.
story with us. And then not just the story, but the way forward. What in the world? That's awesome.
Yeah,
So, very much appreciate your time.
yeah. Hopefully, I've given some practitioners, people some hope.
Yeah,
They can,
absolutely. And that's what it's
yeah,
all about. So,